The approach I wanted to take for the first talk here was really think about questions that patients ask routinely when they come to clinic, and see if I can try to address them in a bit more detail. The talk is going to be in two parts. The first part is talking about macular degeneration, and the second part will be touching upon current treatments. So, one of the common questions patients ask is, who is affected by macular degeneration? And this is, to be specific, we're talking about age-related macular degeneration. So this is a different disease than macular degeneration in general, which could be for which encompasses a whole host of diseases, from genetic diseases that young people can get to diseases from medication damage to the eye, toxicity from drugs that people take. So when we talk about macular degeneration, and today what we're talking about is age-related macular degeneration. So that is something to keep in mind, and we'll refer to that as AMD. So in terms of who gets macular degeneration, we've heard the numbers. It's astonishing. About 2 million Canadians will have macular degeneration, and about 17,000 new cases are diagnosed every year for wet macular degeneration, and about 180,000 cases for dry macular degeneration every year are being diagnosed. And the cost just to the healthcare system, this doesn't take into account the patient cost and the cost to your daily living. If you just look at the numbers, it's about 8 times more costly for the healthcare system to have patients with macular degeneration. So clearly, just from a health economy perspective, it makes a lot of sense for the government to raise awareness and to push for early diagnosis and better treatment for this disease. As the name suggests, this is a disease that gets more prevalent with age. It's age-related macular degeneration. So if you look at the percentage of patients who have the disease, it goes from about 8% if you're around 50 years of age in the Caucasian population to up to 37% when you reach age 75. So clearly, the older you get, the more at risk you are for macular degeneration. So what is age-related macular degeneration? Well, we've seen some very good videos already that touch upon this. And to briefly review this, so just we are all on the same page for the rest of the day. If you think of yourself sitting inside your eyeball right now, and you look at the door where the light's coming from, the sunlight from through there, that is the cornea. That's the clear window at the front of the eye. That's where people put their contact lenses on. The room inside of the eyeball is completely dark. There's no light. The only light that's coming in is through that door. But once the light comes in the room, it highlights the wallpaper. And the wallpaper is the retina. So the room is empty and has this jelly-like substance, but the wallpaper is your retina. The macula is a very small part of the wallpaper. About 5% of the wallpaper in this room would encompass and form your macula. So we talk, all of you are concerned about this one disease, which actually only impacts 5% of your retina. But that 5% is the one part of the retina that gives you the most defined resolution, the most fine resolution. When I'm looking at you and you're looking at me, that's the retina, part of the retina you're using. When you're trying to read, identify faces, that's the part of the retina that you're using. So even though it's a very small part of the retina, it's a very important part of the retina. So that is the retina, the wallpaper, and the wall behind the wallpaper is the blood supply to the retina. And that's going to be critical when we talk about macular degeneration. But the wallpaper itself, the cells in the wallpaper get most of the blood supply and nutrition from the wall, which is basically a pool of blood with oxygen and healthy nutrients that's supporting the wallpaper. It does affect the part that gives us reading vision, driving vision, and that's the reason why it's the #1 cause of legal blindness in patients over age 50 in the developed world, because it affects such a vital part of the retina. The other question that comes up is, if you have macular degeneration, how quickly will it progress? Can you expect to go blind? So first and foremost thing to realize is macular degeneration does never, or almost never causes total blindness. So yes, it can cause you to lose a lot of central vision and clearly make you meet the criteria for legal blindness, which is you cannot read the big letters on the chart, but it will not lead to total blindness. So that's one concern patients always have. Now, how quickly your macular degeneration may cause you to lose vision comes down to what type of macular degeneration you have. And most people will start off with the dry type to begin with, and then either the dry type gets worse and it becomes what's called geographic atrophy, where that wallpaper, you get patches of dead wallpaper where the wallpaper is not healthy, or you get neovascular AMD or wet AMD, where you get those new blood vessels growing. So again, two types of macular degeneration. The dry type is the much more common type. 85% of patients have the dry type. The wet type, about 15% of patients have it. But the patients who start off with the dry type can certainly move to the wet type. In fact, most patients who get the wet type had the dry type at one point and converted to the wet type. Even though dry type is a lot more common, it leads to only 10 to 20% of vision loss in terms of macular degeneration. Most of the vision loss that takes place in macular degeneration happens in wet macular degeneration. So it's the condition that can lead to a lot of vision loss very quickly. The wallpaper, like I said, is made up of individual cells. It's like little factories, little houses on a street that are working very hard to give you good vision. How hard are they working? Well, they're working so hard that the oxygen and the nutrition they need is the most oxygen that any other cell in your body gets. Compared to your brain, your kidneys, your heart, there's more nutrition going to the retina than anywhere else in the body because they're working so hard to give you that fine resolution in the macula. And if you think of how when you work hard at home, you go grocery shopping to feed everyone who's at home working, doing the laundry and taking out the trash, and you go once a week to Fortino's and get your groceries, and then once a week you take the garbage out. Well, when you look at the retina, you can think of basically trucks from the grocery store coming through the front door and unloading food constantly, and those are the red blood vessels that are bringing oxygen and nutrients. And the purple blood vessels is the garbage trucks that are leaving, and they're constant flow of trucks. There's no break. There's trucks coming in constantly and trucks leaving and taking the garbage out from individual houses that make the retina, individual cells that make the retina. What happens in macular degeneration is that system breaks down. And when it breaks down, you get those little bumps. So you can see those little bumps of garbage that start to accumulate. So those are the individual cells, the yellow ones. Those are the blood vessels that are bringing nutrients in and taking them out. But when you get these bumps or garbage depositing, you can see there's an interruption to that flow of food coming in and garbage leaving. What we find when we look in the eye is we see those yellow deposits in the back of the eye, and those are drusen. Those are the garbage deposits that accumulates. So that is dry macular degeneration. That is what's happening in dry macular degeneration. In wet macular degeneration, things progress because when the cells are not getting the food and the nutrients they need, they release chemicals, and VEGF is the chemical you heard about. They release that chemical that causes new blood vessels to start to grow towards them because they need the oxygen and the nutrients. But these new blood vessels are not helpful. They cause scarring, they cause bleeding, and a lot of vision loss. So that's wet macular degeneration. So that's the difference between dry and wet macular degeneration. Again, the dry macular degeneration, you see those yellow deposits in the back of the eye, and they could be a lot of deposits or a few large ones. That's what we're looking for. That's what your eye doctors see when they look in the back of your eye to say, yes, you have macular degeneration. In wet macular degeneration, when you start to get those blood vessels, we're actually looking for things such as the blood in the back of the eye right there, and this yellow material, it's cholesterol leaking from abnormal blood vessels. So those are the type of things we're looking for when we look for wet macular degeneration. Now, dry wet macular degeneration can become the wet macular degeneration, and it can happen in up to 40% of patients if you have all the high-risk characteristics. So you have a patient who has dry macular degeneration and is functioning very well. Well, they can start to have bleeding in the back of the eye, and if it's not treated early, you get much further bleeding, and then you get scarring. And that's where you've lost a lot of vision and permanent vision. and you cannot recover vision at this time when you reach that stage. Other question that patients want to find out the answer to: if you have wet macular degeneration in one eye, will this happen to your other eye? Well, yes and no. It depends on your risk factors. So if you have wet macular degeneration in one eye, the chance of you getting it in the second eye could be anywhere from 7% over 5 years to up to 87% over 5 years. And the risk factors that increase your risk include how much drusen, how many of those deposits you have in the back of the eye, the size of the deposits, pigment clumping, but the most important thing is high blood pressure. So that's one thing that you can control. The other three you have no control over in terms of your day-to-day living, but blood pressure you do. So those are the factors that will increase your risk of getting wet macular degeneration in your good eye. So if you want to try to minimize that, please control blood pressure, along with other things we'll be touching upon. Now, if you do have macular degeneration and your doctors have told you that you do have dry macular degeneration, what are some key signs that you should be looking for that should prompt you to go in for an eye exam right away? Well, macular degeneration, because it affects the central of your vision, it causes these type of symptoms. It causes you to lose central vision. It can cause blind spots where you're trying to see. It can cause distortions, so lines that were straight are no longer straight, they're curved or bent. It can affect your contrast and your ability to read in different lighting conditions. And this is not news to all, many of you, you go through this every day. But these are the type of symptoms that you need to watch out for, and if they're getting worse, you need to let your doctors know, because that could be a sign that your macular degeneration is progressing and maybe becoming the wet macular degeneration, which needs to be diagnosed quickly and treatment started quickly. This is another reason why patients get frustrated in clinic, and you can see that in their face when they come to see me on year after year with dry macular degeneration, and they say, "Doc, I'm not seeing well." And I tell you, I appreciate that, but at least on the vision chart, you're reading the same. And you probably heard this. Your vision doesn't get any worse in the chart, but patients are complaining they are not seeing well. Because in clinics, we do a very poor job of measuring visual function. We're just measuring one aspect of vision, which is reading vision. But all of these, contrast, how many blind spots you have, your ability to read in different lighting conditions, we just don't have the capacity to measure that in clinics, but macular degeneration will impact that, and certainly you can lose vision in all of those aspects of your vision, and even though your vision in terms of your reading vision may stay the same, there's no doubt that the disease is progressing and impacting you more and more every year. And for patients who don't have macular degeneration family members, this is what patients with macular degeneration see, for instance, when they see a bicycle. They see patches of the bicycle missing or the center part of a clock missing. So that's what they're experiencing, and hence the frustrations. And if you're trying to cut something, make your meal, everything is just not as sharp or clear, and that makes your day-to-day living that much more difficult. This Amsler grid is a key component that should be given to you by your primary eye care doctors. Whoever diagnoses you with macular degeneration, you should ask them for this grid. And you can even download this online. It's called the Amsler grid. But it's a very effective tool. It's very sensitive in terms of picking up change. And the key with macular degeneration, I want to stress, is picking up change or progression in disease. Because if you're becoming the wet macular degeneration, early treatment is key. So you test your eye with you test your vision with each eye, you look at the grid, and you see where the distortions are. And if you have macular degeneration, you will notice some distortions. So you mark them down, and then once a week, you close each eye and look at the grid. And you see if though that distortion is getting bigger, more prominent, that's concerning. Normally you have two eyes, and even if your one eye is getting worse, your other eye will compensate. So the key is to close each eye and test each eye individually. That's how you'll catch the disease early. The other very important questions patients want to know is, can they reduce the risk of macular degeneration? And yes, there are certain factors that are under your control and certain factors that are not. The ones that are under your control are diet. So we'll hear about diet down the road, and I'll touch upon that. But antioxidants, fresh vegetables, fruits are good in terms of the nutrients and vitamins they have. Smoking, it's extremely bad for macular degeneration because, again, we talked a lot about blood vessels and circulation. Smoking damages blood vessels in your heart, in your brain, in your eyes. High blood pressure damages blood vessels. Retina, we talked about how important blood circulation is to the retina. Blood pressure, high blood pressure is bad for macular degeneration. Sun exposure is bad because, again, the more sun exposure you have, and this is UV light. I mean, you don't need to be paranoid about sunglasses, but if you're going to be out for an extended period of time, wearing sunglasses is a good idea because it produces chemicals that can harm the retina. And obesity is another risk factors that is under our control. The risk factors we don't have control about, of course, age, your family history, and the genetics that you may have. Females get macular degeneration more than men. Caucasian patients are much more likely to get macular degeneration than patients who have a light-colored eye. Those variables, obviously, you don't have control over. What tests may be done for macular degeneration? Well, if you come to clinic, clearly an eye exam, a dilated eye exam is key. Because your doctors will look at the back and tell you whether they see signs for macular degeneration. We'll sometimes do a fluorescein angiogram, a dye test where they inject dye. OCT test is another test, and again, this looks at that retina, the wallpaper. This is how the wallpaper should be looking like. It's a thin layer of tissue. In macular degeneration, you get these bumps in the back of the eye, and you get these pockets of fluid forming. And many of you come for monthly injections. We keep repeating these OCTs because we're looking for fluid in the back of the eye when we want the fluid to go away. Now, I only have a few minutes left, so I'll quickly touch upon some current treatments. Dry macular degeneration, do we have treatments? Well, no, we don't have treatment for any macular degeneration. We can control or reduce the risk of progression of the disease, but there's no way to cure macular degeneration at this time. The things we can do, lifestyle modifications, we talked about this. Regular eye exams to make sure that you know if you have macular degeneration and if it's progressing, and nutrient supplementation. This is an important point I want to touch upon. So all of this comes down to, and this is, again, a key message I hope people will take home today. People talk about these vitamin supplementations for your eyes. This comes back to one big study that was done. They looked at patients with macular degeneration, put them in 4 different categories. You either had no macular degeneration or really bad macular degeneration. Then they gave patients different vitamins and followed them for 5 years, actually longer now. It's a longer time follow-up now. And what they found was that if you had no macular degeneration or very early macular degeneration, over that 5-year period, it did not have an impact in terms of whether your disease got worse or not. Again, this is only 5-year data, but if you don't have macular degeneration, it did not impact your risk of getting the disease. But if you had moderate amount of macular degeneration, yes, it reduced your risk by 25%, your risk of the disease getting worse. So that's why when you see your eye doctor for macular degeneration, find out what category you have, and you want to monitor that because once you reach a certain threshold, that's when vitamin supplementation should be highly recommended. Prior to that, it's controversial. People are fixated on lutein. Everyone comes to me and wants to take lutein, and they leave everything else. And yes, lutein is a key component of what we want to be taking, and it's found in vegetables and fruit that are brightly colored. It's this vitamin that actually acts as a protectant in the back of the eye, protects the eye from UV damage. It does lower your risk of progressing to macular degeneration by about 43% in some subgroup of patients with the disease. Omega-3 fatty acids are important as well, and it's been shown that people who took omega-3s or had at least more than 2 servings of fish every week reduced their risk of getting macular degeneration by 40%. So eating healthy, eating fish, omega-3 fatty acids is also important. But this is a new study that came out very recently. And so this is the next step of the ARIDS study, ARIDS 2. And it gets very complicated in terms of how it was designed. But I want to jump to the conclusion. And the conclusion is this, and this is a key point. This is what ARIDS 2 now recommends you need to be taking. And so when you pick the vitamins up from your stores, make sure they have ARIDS 2 on it. Because just taking lutein is not good enough. A lot of people are out there taking lutein and more lutein, but that is not good enough. You need to take a combination of these medications, and the best way to make sure you're getting that is to make sure you see the word ARIDS 2 on it. And it has a combination of vitamin C, E, lutein, zinc, and copper. So make sure the vitamins you're taking meet those in criteria in terms of treatments. And now very quickly, wet macular degeneration. This is why I see many of you every month. We heard about laser treatment as an option in the past, but it causes permanent damage, so we hardly ever use laser anymore. It's not the treatment. We have new drugs that we've been using in clinic, and many of you have been getting these every month, and I'll touch upon these briefly. What happens in wet macular degeneration? There's this compound VEGF. We have heard about this. Your eye releases this compound VEGF, and it causes leaking and new blood vessels to grow. Drugs like Lucentis block that VEGF. Very recently, a new drug has been approved in Canada, Eylea. It actually works in a similar fashion. It blocks VEGF and causes the VEGF levels to come down. Results are very promising. Again, very effective in terms of gaining vision for patients. So these are currently the current stays for treatment. These injections given in the eye very frequently to stop new blood vessels from growing. You all have gone through the injections. You know what happens in clinic. We clean your eye and you get the injection in your eye. Surgery is an option, but in a very, very small group of patients. So I think I'm over time, but I'll stop there. Yeah, so the question is the VEGF molecule we were talking about, is there a blood test that we can use to measure? Yes, you can measure VEGF in the blood, but it's not very relevant because the eye concentration is so much higher. So what you have in the blood is really not reflective of what's happening in the eye. So the better way of measuring it is by taking a sample from your eye and measuring VEGF levels. Clinically, it doesn't really impact what we do because we can see the effects of VEGF. So when we do these OCT testing and imaging, we can see the leaking in the fluid that VEGF is causing. So we don't actually need to take a sample from your eye every month to measure VEGF. So it's possible, but in terms of clinical relevance, we look at the effects of VEGF, not the value of VEGF itself. But it is possible, yes. So the question is, there's surgery out there to replace cells in the eye with stem cells. So we'll touch upon this in my next talk, which we'll be talking about research that's coming down the road. So yes, work is being done on that, and we'll touch upon that.
So I'd like to thank Dr. Chaudhary for sharing that wonderful talk with us. I think we all have a better understanding of AMD and the current research and treatment possibilities, thanks to your presentation. So let's give Dr. Chaudhary a big round of applause.